OK, let's go to our other top story this hour. The UK health regulator has approved the Oxford AstraZeneca coronavirus vaccine for emergency use. The government's already pre-ordered 100 million doses. It paves the way for a huge expansion of the government's inoculation programme. It's got implications around the world because it's by far the cheapest vaccine to buy of those approved so far. And it's easier to distribute than the Pfizer-BioNTech shot. UK Prime Minister Boris Johnson's welcomed the announcement, calling it a triumph for British science. He's added that the UK is now going to move to vaccinate as many people as quickly as possible. Let's speak to Rory Challands in London. Rory, this has obviously been a significant step ahead, but the question is, of course, is it going to be enough to be able to deal with the numbers of people who are infected in the UK?
Yeah, well, 100 million doses, assuming that that is actually what is delivered, is enough to cover 50 million people. It's a two-dose medicine, so you need one shot in the arm, and then you wait 12 weeks, and then you get another injection with your second dose. So 50 million people, that's a big chunk of the UK population, which I think is about 60 million, something like that. So it's a huge step forward, and it couldn't have come at a better time, really, because the situation in the UK has been worsening significantly over the last few days. For 2 days running, we've had record numbers of new infections. We had 53,000 new infections yesterday, and we had in excess of 40,000 new infections the day before. We have more people in hospital at the moment, some in excess of 20,000 with COVID than there were at the peak of the first wave. So things are getting significantly worse here. The government, we understand, is today going to extend the tiered system of restrictions on lockdown, essentially regional lockdowns around the country. So good news is needed, and this is very good news. And it's good news because this injection is much more easy to use, much more easy to transport and administer than the vaccine that's being used at the moment, which is the Pfizer-BioNTech one. They both work and they're both safe. They wouldn't have been authorised otherwise. But this one is cheaper, it's more easy to use, and therefore it can vaccinate more people more quickly.
And obviously, a lot of people in the UK are going to be pinning their hopes on this because the UK, you and I were talking about this just a couple of days ago, is facing the prospect of possibly yet another lockdown into the new year as well.
Yeah, so the concerning information that's coming out at the moment is that this new variant of the virus has spread so widely and so fast that medical experts, or some medical experts, are warning that 2021 could be worse than 2020 in terms of hospitalizations and deaths. And the level of vaccination that's going on at the moment, which is about 200,000 people a week, is just not fast enough to be able to combat that. And also that the restrictions that the country is under are just not tough enough. So there is still a high likelihood that even with this vaccine being authorised for immediate rollout, that there will need to be tougher measures taken when it comes to restrictions on people's lives. And I think what people are most worried about, particularly, is that schools are going to be closed again. We don't know that for sure, but that is the way the wind is blowing, that as this new variant of the virus affects younger people more than the older version did, it seems prudent to at least put some restrictions on pupils mingling in schools, move pupils out of classrooms back into their homes and do online or homeschooling again. Parents will groan at that, but that's the way it's likely to go.
Rory, thank you very much indeed. Rory Challands bringing us up to date from London.